Hello, my name is Grace Tudor. I'm a PA student working with your provider today. Are you okay being seen by a student? Okay, wonderful. Well, today I'd like to talk to you about a important health screening that could benefit you. We're going to discuss screenings for colon cancer. I'll explain why it's recommended, what it involves, and how it can help you stay healthy. Feel free to stop and ask me questions at any time. Does that sound okay? All right. Well, the U.S. Preventative Task Force recommends that adults aged 45 to 75 get screened for colon cancer. What do you know about colon cancer? Yeah, okay, so colon cancer is a type of cancer that starts in the colon or rectum. It's one of the most common cancers, but if we catch it early, it's often treatable. Screening helps us find colon cancer before you might have any symptoms. Any questions so far about what colon cancer is before we move on to the different types of screening available? Okay. Well, there are different types of screening tests, including stool tests that check for blood or DNA changes, and colonoscopies that look inside your colon with a camera. The stool tests are done at home and then sent to the lab, while colonoscopies are done in clinic and require some preparation, like fasting and taking a special liquid to clean out your colon. Let's discuss some of the benefits and risks. The main benefit of screening is that it can detect colon cancer early when it's most treatable. Stool tests are non-invasive and easy to do at home. However, they can only help detect colon cancer. They cannot do anything to prevent it. While colonoscopies are more invasive and come with more risks, including discomfort, bleeding, or rarely a tear in the colon, they can, however, help find and remove polyps that might turn into cancer, which results in reducing the risk of cancer in the future. Do you have any questions so far about the differences between colonoscopies and the stool tests? Okay, perfect. I'm going to go a little bit more information then. There are two different types of stool tests available. We have the fecal occult blood test. It looks for microscopic blood in the stool and it's done every year. And then we have the fecal immunochemical test. It's a stool DNA test, so it's looking for DNA markers that might indicate colon cancer as well as any microscopic blood. It's done every 1 to 3 years. The DNA one, it's more sensitive but less specific, so there is a higher false positive rate. However, it gets that added information of the possible DNA markers. So different people have different preferences. And then that colonoscopy, it's done every 10 years, and it's the most sensitive and specific. Do you have any concerns or questions about these screening options? Okay, well, in addition to regular screenings, there are lifestyle changes you can make to help reduce your risk of colon cancer. Eating a diet high in fruits, vegetables, and whole grains, staying physically active, and maintaining a healthy weight and avoiding smoking and excess alcohol can all help. It's important to get enough fiber in your diet and limit red and processed meats. Do you have any questions about any of the lifestyle changes that might help reduce your risk of colon cancer? Would you like any information regarding any of these lifestyle changes? Okay. I also understand that getting to the clinic or affording tests might be a concern. Do you have any concerns about insurance coverage or any out-of-pocket costs regarding these screenings? Okay, do you have any cultural or specific concerns about the screening process in general? All right, and how do you feel about moving forward with the screening? Are there any other concerns or questions you have? Okay, and then do you have a preferred screening option? All right, wonderful. Well, let's schedule your screening then. I'll put in the order today and you'll see a message in your MyChart about scheduling the colonoscopy. After the colonoscopy is performed, I will message you regarding the results and schedule a follow-up if needed. They should go over all the preparation steps prior to your appointment, but if you have any questions, feel free to reach out. Okay, so take care and I look forward to seeing you at your next visit.